women or mothers have after pregnancy is diastasis, separation of the abdominal muscle. Get that pre-baby body back. Actually place the fat within the muscle, and that increases the muscular volume, whether it's in your abs, your deltoids, your biceps, triceps, pectoral muscles, or back, rather than just carving some fat to pretend like it's a larger muscle. Few places and very few surgeons in the world that have started to attempt to perform advanced cosmetic surgery procedures robotically, and that's actually something that I would like to introduce to my practice shortly.
Welcome to the Method Podcast, and today with us, Dr.
Steven Gelb. It's nice to meet you, Alina.
And can you tell us, please, something about yourself, how you ended up to be a doctor, what's your background?
So first, like I said, I'm really glad to be here. I'm originally from New York City, where I was born and raised. And then I was primarily educated all throughout the Northeast. Medicine, technology, art, and anatomy have always been passions of mine, and that drove me to study surgery. In the early stages of my career, I focused on robotic surgery and maximizing my patients' outcomes by minimizing the size of their incisions and decreasing or completely eliminating their need for narcotics in the post-operative surgical process. And cosmetic surgery really ties together both art, anatomy, and also technology. So it really fulfills all of these passions for me.
What is robotic surgery? Never heard of that before.
It's a great question. Robotic surgery is an advanced form of minimally invasive surgery. And what it allows a surgeon to do is to see in 3 dimensions at a console away from the body and manipulate generally like a laparoscopic type instrument to operate inside the body on a very, very small scale with very high resolution. And it lets us do big procedures with a smaller impact on the body, and our patients recover faster with less pain.
Does it use a lot in plastic surgery?
It generally is not, and I think it's very unlikely that you're going to see cosmetic procedures being performed robotically anywhere in the world. That being said, there are very few places and very few surgeons in the world that have started to attempt to perform advanced cosmetic surgery procedures robotically, and that's actually something that I would like to introduce to my practice shortly.
Okay. Is there a specific thing you would like to do?
Women or mothers have after pregnancy is diastasis, separation of the abdominal muscles. And traditional teaching says that you really need to have a tummy tuck in order to fix that.
Which is a completely different story. If you have nothing to tuck, why would you do it?
Right. That's a very good point. So a tummy tuck, you're talking about excising skin. And there are cases where women will have great retraction of their skin after pregnancy, but be left with a more bloated appearance because those muscles are separated. There are a couple ways that you can approach that. One is through either a hybrid tummy tuck with a smaller incision, which I could make just about as small as the size of your C-section scar, and then still do the same dissection and close those abdominal muscles.
It's still a big scar. Well, if you already have the C-section scar, this scar is not a scar.
That's a great point. So that's exactly what I try to tell my patients is if you already have a C-section scar and you have a diastasis, it's almost like a free opportunity to maybe even improve the appearance of your C-section scar.
Yeah.
But repair that muscle separation.
But also, there is a way to also repair the scar as well. If they cut the tissue and sew it over again, right? Is there such a thing?
Yeah, so sometimes those scars don't heal very well and there's some contraction or some extra skin on top of it. So it's an opportunity to revise that scar at the same time as the operation. And that can be combined with high definition liposculpture as well.
How many weeks, months do you need to get back in shape to, for example, do some sport activities and things?
At least in my practice, what I advise patients is that for 2 months after surgery, they really shouldn't be lifting more than 10 pounds to allow that repair of the muscles to heal.
So I had a baby as well, and one of my friends are facing the same problem. I feel like my problem is not that big, but she actually have that. Like her stomach is more pulling up bigger, and she's like always trying to find solution with like sport, exercising to put it back together, but it doesn't seem like it's very working. What should she do?
Well, I think that first of all, your friend is doing all of the right things. Best thing that you can do for your body is to try to get yourself to where you want to be with a healthy lifestyle, diet, and exercise. And certainly, exercise can help strengthen that abdominal wall and improve core stability and improve that diastasis that can form after a baby is. However, sometimes even after we've done all these things, there's a limitation of the human body. And so if, like you or your friend, you didn't have a C-section, and so you don't have a scar, and you're trying to avoid having any scar at all, I can actually use small incisions like we do in minimally invasive surgery and repair that muscle separation without any larger scar. So the same incisions that I'm using for liposuction can be used to repair that. And again, it's only for certain patients that don't have excess skin, but I think that's a great stealthy way to get that pre-baby body back.
How does it even get together? Are you sewing them inside somehow? Like muscle to the muscle?
Yeah. You perfectly described it. What I'm doing is I'm taking the edge of both of those abdominal muscles that are farther apart, and I'm sewing them back together from the top all the way down, and that forms that line that we see on a fitness magazine.
But only 2 incisions.
Well, 2 incisions that I'm working through, but actually 3. There's also a camera port that's going to be there.
Why did you choose working with the method?
I chose to bring my practice to and partner with the method for many reasons. Firstly, as my career in cosmetic surgery progressed, I began to develop and learn more advanced techniques, and those require a different level of perioperative care, a different level of technology, both inside the operating room and outside the operating room. And this facility has all of the things that I'm looking for my patients. State-of-the-art technology inside of the operating room, great technology outside of the operating room, like a hyperbaric chamber, which can really improve your post-operative process and your results.
And just like on a basic use even. I just came out of it.
Which is great, and I want to go and try it someday. And a wonderful team that I know are going to make my patients feel at home and part of this family.
I heard you're a total definer grandmaster. What you can tell me about it? What's the procedures you done?
I'm part of this Total Definer community, and for the past few months, those who follow me have seen that I've been in Colombia about once a month training with Alfredo Hoyos, with his team, and sharing information with some of the top surgeons from around the world. And I'm now performing some of the most innovative techniques in advanced cosmetic surgery and body contouring.
What are they?
So that's a great question. Dr. Hoyos is actually the developer of high-definition liposculpture, which is all the rage. But there's great high-definition liposculpture, and then there's a different type of high-definition liposculpture. What I always strive to bring to my patients is a very natural aesthetic, to make sure that when I'm doing abdominal etching or just accentuating the definition of a muscle group and creating even the most subtle shadow, it's in line with that patient's own anatomy, that it moves alongside you, and that when somebody's looking at you at the beach or at the pool, that there's nothing artificial that they're going to see there.
Like natural but good.
Natural but good. And going beyond liposculpture, there's fat grafting. Most people think of fat grafting when they think of a BBL, where we're adding fat to the fat layer above the butt muscle but below the skin. In other parts of the body, we actually place the fat within the muscle, and that increases the muscular volume, whether it's in your abs, your deltoids, your biceps, triceps, pectoral muscles, or back. And what that does is it creates beautiful, real definition, because the muscle is actually larger itself rather than just carving some fat to pretend like it's a larger muscle.
Okay, so you're taking it out and then putting it back to the place it's supposed to be.
Well, yeah, or where we want
The
it to be.
easy way.
Where we want it to be. So it's one of the greatest cheat codes, because instead of just creating an illusion that the muscle's bigger, the muscle actually is.
Okay. Is it stronger too?
Well, there's studies being done now, and there may be some surprises, good surprises on the way. But I like to practice evidence-based medicine, so until we have really strong scientific data to prove that, I'm not going to say yes.
Okay. But it's looking like it's already a bit of a yes.
We'll have to see. Going beyond just liposuction and these minimally invasive procedures, you start talking about skin excision.
How about tummy tucks?
So first of all, tummy tucks are one of my favorite procedures, and toll definer techniques have actually leveled them up significantly. I think at the most fundamental level, a great tummy tuck is one where if you're at the beach or at the pool, no one's gonna know that you actually had one, right? Or at least they're gonna have to really look really hard. And the main giveaways with a tummy tuck is the larger incision at the bottom, which if it's placed precisely, it's gonna hide well in your bikini line and no one will see it. And the more important one is the belly button, because everyone wants to wear a bikini, or if you're a man, to just wear shorts. And there are some great tummy tuck belly buttons, but there are ones that are dead giveaways. I always try to make my belly buttons cute, innie belly buttons where the scar is hidden inside, and people have to really think twice and may never know, even if they look closely.
Okay. How does it made done? You're undoing them and then redoing them again?
Well, one, I can't give away my trick.
Secret.
I do a type of tummy tuck called a hybrid tummy tuck, where I make a small incision and then I actually detach the belly button from the abdominal wall and bring it down just a little bit without making a scar in the belly button at all. So that's probably the most stealthy type of tummy tuck that I do. It's awesome for the right type of candidate, but really the only way that you're gonna know if it's the right procedure for you is if you have a consultation.
Of course. All the people are different and all needs a different...
And one of the coolest and most novel techniques that I'm now performing is rib remodeling.
Ooh.
So if you know
A tiny waist.
a tiny waist or a Barbie waist, the WASP technique, which uses a ultrasonic instrument and an incision that's just a little bit bigger than a needle that you basically can't see afterwards, to change the shape of your skeletal structure and framework so that you can have more distance between the top of your pelvis and the bottom of your ribs and achieve a smaller waist than any amount of liposuction can accomplish.
That's cool. And it's not that bad as it used to be before, completely removing them.
Right. It's not removing your ribs completely, which could actually have some negative side effects.
Oh yeah, I heard of those.
This is a safe procedure, great recovery process, and can really change the shape of the human body.
And you still have your ribs.
And you still have your ribs. That's right.
Thank you, doctor.
Thank you, Alina.
Nice seeing you today, and I hope I'll talk to you soon again.
Same here.